So MRI has two main components: the hardware, the muscle of the system, which can, which has a lot of mechanical components, and the software, that is the intelligence. So both these make a MRI system. So apart from that handsome machine which you saw in the beginning, there are a lot of other hardware components. And for example, this, the white cabinet which is there, which is labeled as advanced chip. So this is also part of the MRI system, and it helps, or it is required in generation of image. So can anybody guess, like when a MRI gets installed, how much of cargo is actually there? If somebody can just guess that, how much of cargo is there? How much of, it's 5 trucks. Yeah, it's 5 trucks of cargo, like such cabinets, and it also gets inside. We'll talk about that later. So this is a walkie-talkie. So as everybody can see, there is a prominent antenna there, right? So that antenna receives the signal when a person using a walkie-talkie is talking to another person. So similarly in the MRI, we have these coils which act like antennae, and they receive the signal and help in the image formation. So you have a knee coil if you are undergoing a knee MRI. If you are undergoing a foot or ankle MRI, you have a coil which is designed for that purpose. Now these are really beautiful. These are flex coils which are very lightweight, and the gray portion which you can appreciate, that can just fold over. So this really helps obese patients, or who are morbidly obese, patients who are sometimes even 180 kgs, 200 kgs, they do land up for MR, and these coils can just be folded. Say for example, if the standard knee coil is not, the patient's knee is not fitting in that, then these can be folded. They are very lightweight and very easy. Now this is a spine coil which is placed on the surface of the table of the MRI. So if somebody is undergoing MRI of the lumbar spine, the lower back, you need not have anything on top, because this spine coil is placed on the table. So you are completely free. So that really helps the situation. So there are a few strengths which make this imaging tool or modality very unique and extremely strong. So what are these? You can see that there is a MRI image of the whole body on the corner, almost like head to toe. Are you able to appreciate? Yes, so that is, we can do MR from the head right till your toes. So only area which you may not be able to see well is the lung, because the lung does not contain water. So in the beginning I mentioned that water is required for generation of the image. So lungs, of course, if there is a gross abnormality, you may still see it, but MRI is not the ideal way to look at it. Other than that, everything can be imaged using this modality. There is a mention of superficial to deep. So you can see everything that is superficial, that is just below the skin, inwards, that is the muscles, the bone. So you can see the marrow in the bone as well, and that is, it's one of the very accomplished modality to see the marrow. And of course there are other attributes like homogeneity. So when actually the patient goes into the MRI machine, there is a magnetic field of the MRI machine which needs to be homogeneous. Yeah, so homogeneous is like similar all throughout. So that helps us to get great images. And how do great images help us? That is what we'll see later. Now this is example of resolution. Now can everybody see this first image where there is a title of neuro written there? Okay, so now that is the image at the level of our ears. Yeah? And there is a red arrow there? Yes. So that red arrow is pointing to a condition called trigeminal neuralgia, where somebody who has it will have extreme pain along the jaw and even on the inside along the teeth, So these people often keep on visiting dentists, and they don't know what's happening, and neither does the treating dentist know, because it is it's a neurological condition. And this image is 0.5 millimeter thickness. Yeah? So just imagine a safety pin or a needle, and then think that you are looking from the top. So can you see the tip of that needle? So it is that thin. And why do we need that thin images? Because we want to see these fine structures here, where there is that, there's a light gray structure, which is actually the vessel which is pressurizing the nerve, and that is why this person is having pain. You have the middle image. Well, it's not projecting very well, but it's an image of the wrist. So it's an image taken like this, because we want to see the thin, the small bones here. And in medical school, we used to always have very nice short forms to remember things, because there are so many things to remember. So there is a short form to remember these bones, which is, she looks too pretty, try to catch her. So in real life, gentlemen, does that work? No. If you try to catch her, what do you get? So it's just to remember, okay? It's just to remember, it's not to practice. And there is that last image on the top, cartilage imaging. Are we there? Yeah. So cartilage is something which is, on the surface of the bone. So let us look at, for example, at the knee joint, we have a cartilage at the surface of the upper bone, like the thigh bone, and we have cartilage at the upper surface of the shin bone, that is tibia. So the cartilage prevents friction. So in old age, what happens? That this cartilage gets worn off, and therefore the movements become painful. And that's the time when people undergo joint replacement. So very often I feel like cartilage, because I have the same boss at home and at work. My wife also is a radiologist, and a very accomplished radiologist. So she exactly knows how much I work at my workplace, and so I am a cartilage, because I get bashed between two bones. So now we have better designs of the machines, as we said. Like earlier we used to have really long gantry, or the tunnel, which used to be almost like 6 feet, and now we have much shorter ones, approximately 5 feet. So it's much easier for the patients, and there is no claustrophobia. So in actual practice, claustrophobic patients are really reducing now. Like, I guess we come across a claustrophobic patient once in 2 months, and if we counsel them, talk to them, encourage them, they are fine. They will just undergo the scan without a problem. And rare situation, we might just need to sedate the patient. And of course, if you are undergoing a scan hip below, so if you are undergoing a hip MRI, a thigh or knee or ankle MRI, you can be put inside with feet first. Your feet go inside and your head remains out. So that's completely fine. Then there's also audio comfort, like the sound of the MR itself is now reduced, so that the patients don't have much of a problem. And even you could have headphones now, so you can listen to your favorite songs while you are undergoing the MR, which is reality.
Successful treatment always begins with precise diagnosis.